Well, thanks for coming, guys. We do these the first Tuesday of every month, and every time we'll have different subjects where I'll present something probably a little too nerdy and scientific. Lisa, my nurse, and I will enjoy the heck out of it, and you all are going to go, what the hell is he talking about? And then Wiley's going to finish up with what we do here and how this applies to our practice. So I thought we'd do one on neuroinflammation and depression, because there's a lot of what we used to call mental illness. I don't like that. There's a lot of stigmata associated with that. But depression, just our society is so overrun with everything that depletes our dopamine, our happy hormone. Constant videos on our screen, constant. And the rates of depression are just unbelievable right now. And depression used to have such, again, back to a stigmata of mental illness. We all picture the old movies where they show an old psychiatric hospital. And people today still don't like to talk about depression because of that. And we know now there's in a very broad term, there's what we call organic disease and there's inorganic disease. Inorganic would be a car wreck. Organic would be something like inflammation causing a syndrome that we've labeled as a disease state, so depression. So what I want to do with this little presentation is show you that there's a reason for depression. Now, obviously there's genetic tendencies towards depression or certain kind of mental illnesses, but genetics are a light switch on a dimmer. Okay, your light switch may be on, but you may have a risk for cardiovascular disease because dad had it. That's a light switch. It's on. How bright it gets, that's up to you. That's lifestyle. That's why we have patients with the Alzheimer's gene, ApoE, with the 3,4 or 4,4 allele, which puts you at high risk. I have a couple patients in their 80s. They're sharper than I am. And we have people, I have a patient over here at Grace at their lockdown unit who's in her 50s. And she has a normal gene. She has what we call a 3,3 allele. So she's not at genetic risk, but her lifestyle dictated dementia. So that's what we're going to kind of talk about here today. But we got to start it out always. My age does not bother me, it's the side effects. and one of the things we do here is we deal with that. There's optimal aging, right? We're all doomed. We all end the same way. God, when he says you're done, you're done. But be the best you can until then, right? So jump in. So we've always thought of mental illness as a disease exclusively of the brain, right? But we know now, and there's actual tests now, there's a real special kind of PET scan, which stands for photon emission tomography, that can show inflammation in different areas of the brain that we now have associated with mental illness, anxiety in the oblongata, schizophrenia in the frontal lobes or temporal lobes. We can narrow that down, that there's something more, there's something organic to it. And that's what this is saying here. As we advance in our understanding, we're starting to realize that inflammation is huge with depression, huge. And therefore it's treatable, not necessarily with Prozac, right? No one's Prozac deficient, but by treating the inflammation. And so we're going to briefly cover that. The field study is called psychoneuroimmunology, or PNI. And the studies coming out on it are just fascinating. Really, really cool stuff about it. We have known for a long time that the immune system is involved with depression. A couple ways we know that. There was an old tuberculosis drug, we still use it sometimes, isoniazid, that actually was found to treat depression. And they used it for depression for a long time before Eli Lilly came out with Prozac, way back in the 70s, late 70s, early 80s. The problem was it caused hepatotoxicity, it destroyed everyone's liver. But it was an anti-infective that caused it. Another great example is interferon alpha. Prior to having hepatitis C vaccines and a number of other treatments, we used interferon alpha, which increases the immune system's response to recognize the virus as bad. Well, we had something called a sick syndrome with that. People get incredibly depressed, sore, hurting all over. And the rates of major depressive episodes following that are huge. And so I never sent my patients for interferon alpha therapy because of the mental side effects of that. Antibiotics actually cause it. We call it antibiotic. There's a silly term. It's like steroid psychosis. Corticosteroids like prednisone cause, and I warn all my patients, as does Willey, that if I give you this steroid for your pneumonia to try to decrease inflammation, you might be bouncing around the house for a few days. Steroid psychosis. So we know that there are inflammation or immunomodulating drugs that will change people's moods and mental abilities. So I know that's a little small, so I'll read it to you. We know that metabolic syndrome and cardiovascular disease actually double the risk of depression. We know that autoimmune disorders and severe infections increase depression by 50+%. Depression is associated with a higher rate of cancer. But we have to ask, is this a chicken or the egg, right? And the reason is, and we've kind of proven that it's actually the inflammation probably first, using two very, very bad neurogenic diseases. One's called multiple sclerosis, which you're familiar with, and amyotrophic lateral sclerosis, or Lou Gehrig's disease is another name for that. And if people aren't familiar with that, that disease keeps the brain 100% intact while the body totally diminishes. In these progressive neurodegenerative disorders, MS is associated with over 50% depression rates, but ALS is not until the later stages. And so this kind of helps us understand that, boy, there's probably an inflammatory process, something going on that could really trigger the depression in people that are genetically predisposed to it. Not genetically predetermined, predisposed. Light switch dimmer, right? Sources of inflammation are, most of us all know this now, your diet, lack of exercise, your gut health, hormonal health, menopause in women, andropause in men, lack of sleep, no downtime, stress, etc. Those are very well-known sources of inflammation. And unfortunately, we're fed by the food industry that takes no attention to your health, and a health industry that pays no attention to your food, right? That is unfortunate. That is our society we live in. And so diet is huge in that. Fat, and not just obesity, but an imbalance between your lean mass, muscle mass, and your fat mass. So the term we used to use in medicine for metabolic syndrome is skinny fat people. So phenotypically, in other words, the way their bodies are built, they don't look fat. But if you do their percent body fat, they're 30, 40, 50% body fat. That's a high inflammatory state, especially the fat around the liver. And that's where most of this stuff starts, right here. Right now, it's estimated that 80 to 85% of Americans have something called NAFLD, non-alcoholic fatty liver disease. And that is a source of major inflammation, that fat around your liver. Processed foods like meats, oh man. Okay, bacon shouldn't be on there. If you don't like bacon, you're just wrong. Bacon, take that off.
It changed on you.
Oh.
Well, yeah.
See, I was trying to change bacon and change the whole thing, right?
Bacon off there.
But processed food, refined grains, snack foods, sodas, fried foods, ultra-processed foods, those cause inflammation. Here's a little interesting tidbit for you. Through a couple studies, one called the Amos study, showed that ultra-processed foods are not necessarily related to weight gain, but they're related to high inflammatory states, therefore disease states, including depression. Pretty fascinating. Your gut is so important, your microbiome, the bacteria in your gut, we know now, really direct your brain. And the way I like to describe that, if I was to take a pen and draw up my arm, go down my esophagus, through my stomach, small intestine, large intestine, forgive the visual, out the other side, I am outside my body. This tube is outside your body, and it's only separated from outside to inside by one cell layer thick across the whole thing. Well, the good Lord, knowing that if you're going to be exposed to something where your immune system needs to react, it's probably going to come in here or here, nose or mouth. That's why 80% of your lymphatic system and immune system surround this tube. The other tidbit that's so vital to understand is your gut bacteria are responsible for the neurotransmitters. So if I look at like serotonin, norepinephrine, dopamine, histamine, acetylcholine, only 10% are between my ears, 90% right here. So your gut health dictates your brain health. And Dr. excuse me, I don't know if anyone you remember or knew Dr. Rafston, Derek Rafston. He was a psychiatrist here in town. Great guy. When he had someone come in with new onset depression that wasn't necessarily situational, then he would send them to us to do a gut health test and help them with their gut, because then he didn't have to use medication. We help them fix their gut. He didn't have to prescribe them as many drugs. So pretty powerful. And the research there is just amazing how this microbiome is affected by inflammation, high-fat foods, lack of exercise, and how that then dictates your mental health. So the connection there is just amazing. Major depressive disorder actually is a gut health issue. Now, people are starting to, especially the functional medicine psychiatrists are saying, it is not a brain issue at all. It's a gut health issue. Fix that, and you can make a big difference in MDD. And it goes both ways. The brain, mediated by the immune system, neuroendocrine system, and sensory neural pathways. That's why in our clinic, we do a lot of procedural treatments for anxiety and depression. And procedural, I mean, we're doing stuff to the body to affect the brain. And one of my all-time favorites, and I think it's Lisa's too, because she's seen some such amazing things. I do a German acupuncture technique called neurotherapy, and we do neurotherapy directly over the adrenal glands. Because when you were in your mama's belly, you grew up in two halves, and the sensory nerves at the top are still connected to the motor and functional nerves deep. So by doing this German acupuncture technique superficially right under the skin, I can shut off the sympathetic nervous system, which is your fight, flight, freeze, panic, always on system, right? God gave you 15 hormones to run away from a saber-tooth tiger and 1 hormone to go to sleep. So the system's always on. It allows the parasympathetic system, which is your rest, digest, and relax system, to take over. So procedurally, we can change depression. And a very good patient of mine, I've seen her for over 2 years. She comes in every Friday from Idaho Falls, and we do neurotherapy on her adrenal glands. And by doing so, I took her off 5 antipsychotic medications. She's on 0. She takes 0. She takes a few of the supplements. We have a hormone balance, her gut optimized, and every Friday she's here for a procedure, neurotherapy, to change that sympathetic tone. So it's very treatable without Prozac and many others. Diet, low inflammatory foods is what you want to focus on, which is, I call them 1 ingredient foods. So an apple is a 1 ingredient food, right? Applesauce is not a 1 ingredient food, right? If you can't pronounce the word at first temp, don't eat it. When you look at the ingredients. I also like to call, I'll tell you the story behind it. I did a radio interview, it was a number of years ago, and the guy cornered me at the last 30 seconds of the interview. He said, well, Doc, give all my listeners the best dietary advice you can give them. Give me 2 sentences. And it came to me, it was divine intervention. It said, okay, if God made it, eat it. If man made it, don't. That describes everything on this chart. Your 1 ingredient foods, God made them, not man. And it's not just foods. I mean, healthy fats, coconut oil is a great example. Herbs and spices you can use to lower inflammation. Turmeric's the one people know about the most because of the active ingredient curcumin. Strong anti-inflammatory, actually changes your brain. It can actually help treat depression. So using these type of spices in your eating will actually be medicinal or therapeutic. Exercise is so important, in particular resistance training. The muscles are the key to longevity. Everyone's familiar with blue zones? Blue zones, there's 5 blue zones in the world where there's centurions plus that are still completely active. No diseases, still gardening, still going for 5-mile walks, all this stuff. One of the key components of that is not only their diet, but the amount of movement they do. They all do exercises. Because muscles, when they're stimulated and contract, especially against resistance, release something called a myokine, myomuscle-kine chemical, that alters inflammation and alters the other hormones in your brain. So lifting weights has finally I've been telling you this for years, by the way, surpassed cardiovascular activity as healthier. That's why it's so vital that people lift weights, even a couple times a day. I love using, my favorite example is for bones. Studies have shown that 2 resistance training sessions a week increases the strength of your bones by 24%. 3 increases it to 32%, and there's really not a great raise after that. So you don't have to join a gym and exercise 5-6 times a week. Exercise twice a week with resistance training, and you're going to change your brain, amongst other things. What's my next one? Hormonal health, huge. Men, when they get testosterone depleted, women too. Women in menopause, the ovaries release about 50% of the woman's testosterone. So going through menopause, they lose 50% of that. One of the things testosterone does is, as far as an anti-inflammatory, it increases a cytokine called interleukin 10, which is probably your body's strongest anti-inflammatory cytokine. That's testosterone levels at a proper dosing and right levels lowers inflammation, but it also increases dopamine, the happy hormone in your brain. So hormonal balance is optimal for optimal living. And we've all talked to wonderful men and women who've gone through menopause. And one of the biggest complaints I hear about is lack of energy and brain fog. Balance or hormones, those go away. And that's an anti-inflammatory response as part of our intervention there. Adaptogens are usually herbs that can modify hormonal response. 3 that are very well studied in modifying cortisol, the stress hormone, are rhodiola, ashwagandha, and magnolia bark. They're incredible in the natural treatment of depression, amongst other things. We use them a lot. Amino acids, L-theanine. L-theanine is the active ingredient in green tea. That's why it's very calming. My family loves something called sleepy time tea, and that has L-theanine in it. And L-theanine increases GABA, your rest hormone, that one hormone I told you about that God gave you to go to sleep. L-theanine treats that, and incredible because sleeping is also a way to lower inflammation. Using trace minerals like lithium. Lithium, we hear lithium when we think of bipolar disease and some call lithium carbonate, which we have to monitor your thyroid function. We have to monitor for toxicity and stuff. But a low dose over-the-counter lithium orotate can fix brains and optimize moods. It's incredible. We're deficient in it because we don't get it anymore. And if anyone here has any chemistry background, if you look at the periodic table of elements, your life minerals and your life chemicals are on the far left. Lithium is number 2 behind helium, lithium, hydrogen. Yeah, down calcium, magnesium, sodium, phosphorus, potassium. Lithium's right there. And so because we're deficient in that, and one of the actions of the trace mineral lithium is to lower inflammation. Powerful.
Is that available over the counter?
What's that, buddy?
The lithium, is it available over the counter?
Over the counter, lithium orotate or lithium aspartate. 5 milligrams over the counter changes moods. I don't see kids, but if I have a friend that has a son that's depressed or something, I'd say lithium orotate is what I would do with one of the adaptogens and some L-theanine for night. That would be my anti-depression regimen for a teenager. Because Prozac and the like increase suicidality by unbelievable amounts. So great stuff. So now that you understand that there's an inflammatory component, if not the component to depression, optimizing the immune system is a backdoor way to treat the brain. And we do that by optimizing gut health, using peptides to build and support the immune system. Thymic hormones are a big one, like thymosin alpha-1, thymosin beta-4. Neurotherapy, which I shared with you about my little gal from Idaho Falls, that's what we do once a week on her, helps. Red light therapy done it, grounding. Everyone familiar with grounding? It's a connection with our bodies and the earth. A small electrical charge can really make a difference. And if there's some great studies on grounding. And since it's barefoot against the earth, that doesn't happen very often in Pocatello. They have grounding mats, grounding blankets, grounding, all sorts of stuff you can purchase real cheap. It'll change the way you feel. incredible stuff. Hydrogen, breathing hydrogen, drinking hydrogen water. Hydrogen is one of the strongest antioxidants because it binds to oxidants. And so when we have people come in and do IV therapy, we usually hook them up to some hydrogen inhalation or give them a hydrogen glass of water. You can get little jars that make hydrogen for you and drink it. All this stuff will help with treating depression. There's so many other modalities, peptides, non-antidepressant medications that we use to build the immune system, thereby treating depression and anxiety and everything else in that area. I think that's all I had there, because I want to leave some time for questions and Wiley's presentation.